Hello, guys. Welcome to this new edition of Mind Podcast. This is Aadit Kapadia, and this is a very special edition of Mind Podcast. We're not going to be doing our usual news of the week where we break down a few topics and stuff. Uh, I wanted this podcast, this interview, just to focus on a very serious situation that's happening in India at presently, and I have someone from the ground, Dr. Amit Thadani, who's a surgeon by profession. He's in Mumbai. He's a columnist. He has written for Mind, for ORF. He's written some terrific pieces, and he's at the front line battling this COVID. So before I even introduce Dr. Thadani, thank you so much, Amit, for what you've been doing for everyone. I mean, this is truly incredible.
Thank you for the appreciation, but yeah, it is tough.
Yeah,
It's
I mean,
sticking.
I can't even imagine what you guys are going through. And when I say you guys, because not just you, there is a whole support system with you that is helping you take care of these patients, and a whole support system in the family who has seen you guys just do this relentlessly for the last 13 or 14 months. And this is probably even more like crazier than what it was last year.
Oh, yes, that is by far much more crazier than the first wave. This is quite nightmarish. In fact, it's been an extremely difficult time for us. The first
Absolutely.
wave, we had a lot of patients during the first wave also, but it was nowhere close to this in intensity and the severity of patients that are coming, and in the magnitude of problems that we are facing even to keep providing the support system. So
Yeah.
this is really very challenging.
Because for anyone who is on Twitter, Facebook, WhatsApp, any social media channel, they know the deficit of oxygen, hospital beds, treatment, remdesivir injections, so many things that people are facing across India. And Mumbai, right now, it's a little better than probably what it was 3, 4, 5 days ago, or maybe a week ago. But that was when it was the peak at Mumbai, right? So, what is the situation right now on the ground? And Delhi seems to be, and Lucknow and Ahmedabad, those three seem to be the worst hit right now.
Yeah, so a lot of cities have been hit simultaneously, which is actually causing a crisis of supplies across the country.
Hmm.
So many states have been hit at the same time, and many big states have been hit at the same time, which is why we are facing such a crisis of supplies. Earlier what had happened during the first wave was that the tanker services diverted supply from Madhya Pradesh, Bhopal, which areas were not that affected,
Hmm.
and those
Hmm.
supplies were diverted to the states which were more affected. This time around, all of these states which are surrounding Maharashtra per se have also been severely hit.
Hmm.
So there is no way that oxygen can return. The only thing you can do is generate more oxygen, divert more oxygen, and
Hmm.
that takes time. It doesn't happen immediately. The
Yeah.
requirement goes up now, and the supply is bound to falter at that point in time.
So,
That's what happened. Now, till
so
the
to
time the fresh supply chain is arranged,
yeah.
it's a struggle.
So to sum up what you're saying, now the core issue has become more of infrastructure related rather than just because the infrastructure that we had last year was barely coping up with what we had. This time the wave is probably twice, if not three times, as severe as last year. And because a lot of cases there is just like, and I'm not saying that there is not enough testing happening, it's just the system is so overwhelmed that I don't think they can test as much as the infection seems to be spreading. I mean, the positivity rate in Delhi is 30%, which is unbelievable.
Yeah, even in Mumbai, the positivity rate was 30%. And I frankly don't trust the positivity rate anymore.
Yeah.
Especially in Maharashtra, there is no point of testing the positivity rate
Hmm.
because once the government decided that all corporates, all industries, all factories are going to test all their employees every 15 days,
Hmm.
you're testing people who are asymptomatic, and the logistics involved in it made it impossible for people who were actually suffering from the disease from getting the test done. So most of these patients were tested with CT scan and with other modalities, whatever was available.
Hmm.
And obviously the TPR is going to fall,
Yeah.
right? It's
Yeah.
not as if the people aren't getting ill. It's just that those people are being missed from the system. They have to get tested. Every employee has to get tested once every 15 days. And that also they specified RT-PCR has to be done. I don't know who took the right decision, but because of that, so many samples of RT-PCR landed up with the labs that they were unable to do the samples of people who were actually sick.
Yeah.
And for 5 days we were waiting for the report. Fortunately, that situation was rectified in a couple of days when they said that okay, you can do antigen test also. And so that clog up of the system has now disappeared, and now reports are again coming in a day or two.
Day or two.
So, so the entire data of the last 15 days is unreliable for that matter. You can't trust that data. How I felt that this wave is reducing is from seeing, from a visible drop in the number of calls that we were getting. One, from the nature of patients who are coming to your hospital, and from a few other features which we have seen in the earlier waves, where we realize that now this is just starting to die out. So
the advantage of hindsight, so to speak, that what you saw last year, you can similar. Yeah.
So that's what it is.
Yeah, but because I mean, right now it's almost impossible to know someone in India or have a personal connection who hasn't been affected with COVID. I personally have had family members, friends, various friends in Ahmedabad affected, and I'm hearing new things. I mean, I always tell people that what they would tell me about US last year, that they were terrified of opening their WhatsApp and seeing who got tested positive. Similar things have it has flipped, because last December, January, when I tested positive, Houston, New York, I mean, everything was going, it was very scary over here. But what seems to have happened in US, at least in parts of US, is excessive vaccination, extensive vaccination, and the mask situation is still I mean, it's still mandatory, but there are some people who are on the fence about the mask. But vaccinations seem to be going there. Almost a third of US has been fully vaccinated now, right? So do you see that as the only way out for India as well, that we have to reach that crucial 70%, which is required for herd immunity in India, and then 70% of adults, when I say 70%? Yeah.
Not only adults, you have to reach 70% of the population. 70%
I'm
of
sorry,
population means 100% of adults.
100%. Yeah, correct. That's what I meant. Yeah.
I would go a step further and say, that all the children need to be vaccinated also, because children are the most notorious carriers of this virus. And I don't know if you know this, but in India, the maximum mortality amongst all doctors during the first wave was in pediatricians.
Oh wow, I
Yeah,
did
it
not
was
know
in
that.
pediatricians. So that's why I'm saying that children are the most notorious characters, because they don't get the disease, right? They don't show many symptoms. They'll just have a little cough cold, if at all, and children have cough cold all the time, right? So you're not going to suspect. They'll infect their parents. They'll infect the pediatrician. They'll infect all the people who are coming to the clinic when they're there. Very notorious carriers.
Yeah, that's
This is
actually
what people don't realize. And the child is not going to sit in one place, he's going to run to 10 people and infect all 10. So it's a problem. Yeah. So children need to be vaccinated. You can't.
Also,
That will.
Yeah, sorry, complete your point, Amit. What would you say? Yeah.
He's saying is that basically we have a better immune response. Okay. Children have a better immune response. So you vaccinate a child, he would need less doses of the vaccine to develop lifelong immunity. That's the reason why these vaccines are given in childhood. Most of the vaccines are given in childhood.
Yeah, absolutely.
Reason why they're given in childhood is because they develop a better immune system in childhood now. And people need a dose throughout lifetime. So it's like that,
Absolutely.
So there is a legit case for giving the vaccine to children. Why it isn't is because we don't have studies. And now there are people who are doing studies on vaccination in children also.
Yeah.
So I believe that vaccinating children is also very, very important.
So in US, 16 and up they're giving, and then Pfizer and Moderna is doing studies for 12 and 16, between 12 and 16. And what is interesting in India is also that in June the school year will start. So, and I don't know if, this time they're going to do the same thing as last year. So if they are encouraging or telling kids to come back to school, or, in September to colleges, then that's the first step that should be taken, to vaccinate the kids before, they're sent to school and so forth. So that is a huge sort of
And
thing.
that's not going to happen.
Yeah.
Yeah, that's not going to happen over here.
Yeah. And
They will keep the classes online.
Yeah, and we're talking about 60% of the population that is below 35 in India, maybe even higher, right? And usme se bhi, I think if you narrow it down to the population below 15 or below 16, it's a huge number. So it's not going to be easy. Yeah. And the
Unless you
production.
vaccinate 100% of adults, you can't reach 70% of population. So the next logical step will be get proper studies in place and vaccinate children. You have now that there is enough evidence that vaccinated people don't transmit the disease much. So there now is a legit case for vaccinating everybody.
Yeah, because even if you
Earlier we
assume
didn't know.
even if you assume that about 70, 80 crore people need to be vaccinated, that's about 150 to 160 crore doses. Because, and this is not accounting for any error, anything. This is a minimum, that much you need. And right now, I think production wise also, we need to ramp up. I think right now they're doing 12 or 15 million doses a month. That needs to go up to like 50 or 60 million doses, if I'm not mistaken, a month, production wise as well, to vaccinate.
Yes, we don't have enough vaccines. I don't know why the health minister keeps saying we do.
Yeah.
We obviously
Yeah.
don't. The numbers he quotes that we have so many million and that many million are 1 week's quota.
Yeah.
If the moment we step up the vaccination, it'll run out in 2 days. We don't have enough vaccine. It's you might as well just say that we don't have enough vaccines to go fast. The US is holding up essential items needed for us to push the production further.
Yeah.
So now ways and means have been found around that, where Bharat Biotech has joined up with some 4 other tech companies to produce those adjuvants in India itself. But that's a time-consuming process. That doesn't happen overnight. It'll take at least a few months before they get that sorted out. Then our dependence on the US for these raw materials would be done, once and for all.
Yeah, and the US administration was asked this question and they completely avoided it.
So I didn't get that.
No, I'm saying the US administration, the Biden's press secretary was actually asked that question and she completely avoided that question, sidestepped it. That why are you blocking essential goods to India?
Every country will look after their own interest first.
Yeah, but I honestly don't think US is at a. I think US may have probably, if not now, in a month or something, enough vaccinations to vaccinate the entire country. I mean, you're talking about that 40% of the countries, or 35 to 40% is already fully vaccinated, if not close to 30. So, I mean, and the rate at which they're going 3 million doses or more a day, it's not going to take them long. So. Yeah, so I don't understand why the holdup is happening.
There is some amount of vaccine hesitancy here in India even now. Many people have not taken it for whatever reason, maybe WhatsApp forwards or just not interested or whatever. Yeah. So there is a high level of. So how do you reach 70% when half the people out of them don't even want to take the vaccine? Right. So you look at age groups beyond what you are targeting. Right.
Absolutely.
And there is some mess up in the numbers also. Like it's the official data says that only half the healthcare workers have been vaccinated, whereas what we have seen in cities like Mumbai is that hardly anyone is left who has not been. So maybe there is some duplication in the list which is missed, or there are or there are actually some healthcare workers who have not taken the vaccine. There are a few, of course, we know, for whatever reason.
Yeah.
Most of them took it and they realized later on that actually it's going good and nothing much is happening. So I don't know where that 50% figure comes from, really. So a lot of people
also,
and maybe are not even on the list.
One question I had for you, Amit, because a lot of people said this, Kere, you take the two vaccines and there is, you still get infected and stuff. Vaccines are supposed to reduce the intensity of the infection, right? They are not some shield that you wear that suddenly the infection will go and repel. Right? So I don't know where this misconception is coming that you can still not be infected, but you can make sure the vaccine will reduce the intensity of the infection significantly. There have been studies, there is data that shows that, right?
Vaccines will definitely reduce the intensity of infection without a doubt, and I have seen it even in my own family where senior citizens who are vulnerable with multiple comorbidities who got COVID didn't show much symptoms or
Yeah.
really advanced disease.
Hmm.
Well, the young people actually showed significant lung involvement. Some of them required hospitalization also.
Hmm.
So even in the hospital, we have seen this where we've had patients who've been vaccinated earlier who required admission.
Hmm.
None of them went on ventilator, and none of them turned so bad as to pass away. So there is a visible difference. The virus targeting younger people with more severe disease is also kind of a sign in our uh,
Yeah.
area. We had a lot of young patients with very severe disease
Hmm.
and elderly vaccinated people who don't have severe disease, right? So the demographic shift also suggests that maybe the vaccination program is responsible for loss of that
Lots of life.
that
Yeah.
vulnerable population to the virus as such.
Yeah.
So it's a good thing. We should just pursue it and keep going on a war footing, with this.
Yeah, absolutely. Aggressively pursued, if I may add that term to it. But moving forward in the situation where you are saying in Mumbai, if not the peak, if the peak hasn't hit yet, you are at least saying we are close to the peak because you are seeing a drop down. Do you think we are going to be seeing that in other cities as well in the next few weeks, or do you think this is there to stay for a long time?
No, this right now the way that it's going, it will peak off and then it will fall again. The same thing will happen that happened last time, that it increased, and then suddenly you find, okay, where did it go and why did it go? Some
Yeah.
senior government officials are like, we don't know why the numbers suddenly fell off, and I don't think they anticipated what would happen next, unfortunately.
Yeah,
So
the
what
downtick
happens?
or the uptick, no one expected.
Quality of advice which people were
Yeah.
giving with
Yeah.
super intelligent expert advisors saying that we have already touched herd immunity, 60% of the country has antibodies from a sample size of 2-3 thousand. Come on. uh, that's not how things are done, right?
And especially when you don't know how many variants this virus has. I mean, even in 2-3 thousand people, what are you looking for?
Yeah, exactly. So you look at antibody prevalence,
Yeah.
which was high in Mumbai slums, and in a way they are right as far as Mumbai slums are concerned, because
Mhm.
Mumbai slums haven't exploded this time around.
Yeah.
Initially it was the slums predominantly which were affected. This time around, all the remaining sections are affected. So yes, maybe they were right, but then they weren't touching half the population, right? They were just having a small database to begin with.
Yeah.
So that's how
Yeah.
it is. The
Absolutely.
quality of evidence matters. You can't, just extrapolate whatever you feel like because it sounds nice, and that's why that's why I think we are paying a heavy price for it.
Right.
People were like, why isn't UP and MP getting infected? Now see what's happening there, right? There's no herd immunity. It's not going to happen either.
Yeah, and UP and MP are so overwhelmed in terms of the amount of I've talked to friends from Lucknow, especially Lucknow is looking very, very grim right now. And prayers go out to the people in Lucknow, Delhi. I mean, prayers go out to people everywhere, but especially those cities, because it's not just the people who are affected with COVID, it's also the caregivers, the family, and the density of population is so high that one bad thing is affecting colonies and people in colonies and things like that. And I, and right now we are sitting in hindsight or something. Do you think we got a little complacent after India actually did pretty well with the first sort of phase. And I mean, I'm not saying we didn't lose enough lives. Even one life lost is too many. But comparatively, if you look at percentages, India did do better than a lot of Western countries, right? So do you think we got a little complacent after that and dropped the ball?
Yeah, without a doubt. I
Yeah.
mean, health minister was saying things like we are in the end game of coronavirus pandemic, right? So yeah, we did get we did get complacent. Obviously, if you started believing that we've defeated
Yeah.
corona, then you will not expect it to come back right up and strike you again.
Yeah.
And then what's worse is that when visibly there's a trend of numbers rising in city after city across several states.
Hmm.
What did they do about it? Nothing.
Hmm.
Uh, really speaking, and that was the time that they needed to step in again and say, okay, the numbers are going up again
Hmm.
in all across. And it's not just one state. MP numbers are going up. Gujarat numbers are going up. Maharashtra numbers are going completely haywire.
Yeah.
That was the time they should have stepped in and said, okay, we need to, look after these governments and, start issuing fresh directives that are,
Yeah.
curtail restrictions. I am not at all in favor of a lockdown. It doesn't help. But
Yeah.
the restrictive measures could have been quickly reimposed at that point itself, or at least the government should have been directed to impose it. I think that was an opportunity missed. Now it's too late to impose a lockdown. I don't know why the Maharashtra government has decided to impose a lockdown. Now it's already too late for it. Everything has
Yeah.
already been done. And
No, there is the whole thing about the Maharashtra government of doing something and seem to be doing something. That's where it's caught in between.
see, you do a lot of things, but and there is a certain level of competence expected from any government.
Yeah, absolutely.
All I can say.
Absolutely. No, no, I completely understand. But in closure, before we end the interview, I wanted to, like, in the days ahead, what are we to expect? And I'm not telling you to be a predictor or a soothsayer on this, because predictions don't work with COVID. We've seen that in the last 12 or 14 months, right? But in terms of infections or something nationwide, do you see eventually them picking off? And do you see that if it's affected in some cities, there could be some measures taken so that they don't spread to rural India also? Because if it does, the infrastructure is going to be really, really hammered if that's where it goes.
Let me just say this:
Hmm.
it's already in the rural areas. Okay,
Even
I
at this
yeah.
intensity.
Oh yes, we work through our trust. We work in rural areas, right?
Yeah,
Now
absolutely.
there are some tribal villages where we are working since the past few years, which are a good 4 hours drive from Mumbai in the deep interiors of Palghar, Jawahar, and in that district is quite backward and it's very tribal, and we work in some of the deep interior villages over there. And when our team visited there a couple of months back, right? Not even this month. I'm talking about March and April. March, somewhere in the middle of March, and almost 100% of the villagers were running fever and showing symptoms. Almost 100% of them. Nobody was willing to get tested, and the few who did get tested positive.
Hmm.
So it's a myth that it's only in urban areas. It's in the rural areas very much. It's in also the tier two cities.
Hmm.
We just lost a close relative in Sitapur, Hardoi area,
Hmm.
and he was. That's not a big city. It's just a small town,
Yeah.
right?
Yeah.
And that's of course in UP. So it's there even in the smaller towns. I get a lot of calls from the interior areas of Maharashtra, from Roha, from Alibag,
Hmm.
uh, which don't have that great a healthcare system as such. Which are around 100 kilometers inside. So it's very much there in the rural as well as in the smaller towns and cities. It's just that they don't get as much publicity, and the people travel to the bigger cities for treatment. So I don't think that's really true. That it's what would happen if it affects the urban areas. It's rural areas, because it's already there. It's already in the rural areas.
Absolutely. Well, I think as Amit said, I think the biggest thing seems to be get vaccinated people, and between the second wave and any, like, once it ebbs, so to speak, right? And which we are saying that it might be happening sooner than what we think. This is the light may be closer at the end of the tunnel than what we think. But between the second and the third wave, India needs to vaccinate and vaccinate massively, because that's the only way.
Yes, exactly. So it's going to come back, and we need to anticipate it this time and create a big strong wall of vaccinated people as defense. And I don't think that even just going with above 18 is going to help. Open
Yeah.
it up to everybody and vaccinate everybody. And even
Yes.
till a few days back, I was saying that vaccinate everybody above 18. But the day we have data available for safety in children, it should be immediately extended to that group of population as well.
Absolutely. And maybe there is a case for where the sites for emergency COVID testing had taken place, make them vaccination sites, so that you don't even have to build infrastructure around it. Make sure
It's so easy to open up vaccination for the masses. You
yeah,
have the biggest network of general practitioners anywhere in the world is there in India, right?
yeah, absolutely.
You have 70% of India's private practitioners are GPs,
Yeah,
right? Each one has got 30, 40 families who keep coming to them for treatment. You just imagine how easy it is.
yeah,
You
it
just have
is.
to make vaccines available in sufficient numbers. The day vaccines are available in sufficient numbers, it will take us a month to finish the vaccination of the entire country.
Absolutely.
Don't
And,
have
and,
enough
and
vaccine. See, that's the reason it's going to take a year because we don't have enough vaccine.
yeah, and unless and until some ramp up on the production happens, and again, these are what Amit is saying is based on the current data we know. Now, of course, if the easing in of the US thing happens, if there are some production issues that are resolved, that could happen a lot sooner than we think. But we are all living in the hope, right, when it comes to that. So, but one thing, but any closing comments, Amit, before we say goodbye? Any final thoughts you want to share with our viewers, listeners?
Yeah. So I'll just want to say this, that it's been an extremely hard time for us the past few months. It's been really tough, and we've done the best I could. It's obviously not good enough, but I don't think we could have done anything else beyond what we've already done. And I just want to add that we're seeing a lot of negativity about India's broken healthcare system. No, it, the pandemic was of massive intensity, but it hasn't broken us. We've fought back. We are getting things back under control, and you know, I'm not going to say that we are going to beat this because obviously it can rear up again and strike us back immediately. But this time around, we need to be more cautious and do the maximum possible to prevent the third wave from hitting us. So wear a mask. That is your primary defense. In a city like Mumbai, you can't keep distancing, but wearing a mask is by far your best defense. Wear a mask and wear it properly till the time we finish vaccinating the entire population, or at least 70-80% of it. Your mask is your vaccine. That's all.
Absolutely. No, I couldn't have said it better. Thank you, Amit, for all the work you've done, and from all of us. It's been an overwhelming time for all people in the medical system and so forth. But we appreciate you, and thank you for taking out the time to talk to us. I know how hard it is right now, but I'm so glad you came and you clarified the positions and answered various questions that our subscribers, listeners may have. And hopefully, this gives them the hope that we are fighting as one city at a time, and hopefully the end is a lot nearer than what we think.
Hopefully, yes.
Thank you guys. Please like, subscribe, follow us, share this video, write to us. Please write our comments on any questions we have. Maybe after this pandemic is over, Amit and I will do a follow-up session on what India did do and what what we could have done better and so forth. There are a lot of lessons to be learned, but so far we are fighting. India is fighting, and let's be proud of everyone who's been fighting and doing their best. So thank you all so much for tuning in. We'll be back very soon with another podcast. Till then, it's goodbye. Thank you. Appreciate it.